Hello, I am Dr. Carey. I'm a pediatrician in Ventura, California, and this is Dr. Carey's Baby Care. Today I have Sunil Ilapogu, and he is a pediatric dentist in Ventura, and we are talking pediatric dentistry today. Welcome.
Thank you for having me. I'm excited about being here.
Excellent. I'm excited for you to be here too. You get our brand new set. This is all
very nice, yes.
A new change.
Yeah.
Boy, I don't know how every time I struggle to open a little child's mouth to take a look at what's going on, I still can't get over how a pediatric dentist has the patience to make it through the day.
You know, that's one of the most common things I get asked with parents is about, how do you do this all day long? I say I love doing this on kids. I much rather do it on kids than adults, so it's fun. And you know, what's great is, you know, pediatric dentists usually they have that inclination, but the staff and everyone that's associated with it, they're kind of honed into making that happen. And so, you know, you can have those 90% of our patients are great and some that are uncooperative, but we make it all work.
That's
so
the
it's
way
great.
it goes.
Yeah.
Okay, so you have a newborn. You have a child through quite a long time without any teeth. What are parents to do?
So you have a newborn without any teeth, and one of the things that we look at is there's varying degrees of children getting teeth, and one of it is, you know, the average for most kids is 7 months. Some of our girls tend to develop early, sometimes as early as about 3.5 to 4 months, and some of our boys are that 10.5, 11. So if by 12 months we're not seeing any indication of any teeth coming in, that's definitely an indication to come in and being seen by the pediatric dentist, because we want to make sure that we're seeing them, they're not missing, because certain loss of teeth can also be associated with some different medical conditions that we want to rule out. Most of the time what it is just we have some late bloomers getting their teeth in a little later, so it's usually not a concern. But kids vary all over the spectrum. As a general trend, you know, females hit those dental milestones a little bit earlier, and boys. And the primary teeth kind of dictate how the permanent teeth will come in. If the primary teeth come in early, usually that's what's going to happen with those permanent teeth when they start to make their way in as well.
Interesting.
Yeah.
I always tell parents, because they always come in and say, oh, I think my child is teething, and I point out, no, drooling is a sign of drooling. When
Yes.
you see that tooth pushing through the skin, then you have teething.
Exactly.
Everything else is just a baby thing. Is there anything that parents need to do for the gums prior to the teeth coming in?
So that's one of the things I get asked all the time. Hey, do I have to do anything when there's no teeth in the mouth? And one of the things that we'll start doing from the get-go is, after nursing or a bottle, wipe the gums with a clean cloth. Helps to keep that milk and stuff that's built up on that ridge. A lot of parents love using those little finger brushes that, you know, help massage and soothe the gum. But one of the great side effects of doing that at an early age, they get used to having things in their mouth, and it kind of gets them prone so that when they do finally cut teeth, it's an easy transition to start getting that toothbrush in there and starting to phase out that, you know, clean washcloth and those finger toothbrushes. Yeah.
So now you have your child who is about a year of age. You have 2 or more teeth in at this point. What do they need to do at this point?
So one of the things that's great about that is, you know, we have a lot of parents that say, hey, I love this finger toothbrush and getting off there. You know, as soon as the first tooth cuts through, we want to start using an age-appropriate soft toothbrush. And, you know, if you go to any of your grocery stores, your pharmacies, your Whole Foods, whatever you go to, you can't buy a hard toothbrush hardly. And so it's just figuring out what the size that matters. But it's the mechanical motion of that toothbrush that's getting that plaque physically off the teeth. And so as soon as you have that first tooth coming through, you have to start going away from that little plastic little tongue massager and going to a toothbrush, whether it be 1 tooth poking through or 2. And then, you know, usually you're going to have them in rules of 2. You get those first 2 on the bottom and the top, and then the outsides start coming in and go from there. But as soon as that first tooth comes through, we have to start transitioning into age-appropriate soft toothbrush.
Do they need toothpaste at that point?
That's a great question. Usually under the age of 3, I'll have them use a non-fluoridated toothpaste, and there's a variety of those on the market. Colgate, Crest, whatever you have, will have those non-fluoridated toothpaste. Remember, it's a mechanical motion that gets that plaque off the teeth. So if kids have a sensitivity to taste or sensation of having paste in their mouth, just run that toothbrush under some warm water. Another great alternative is xylitol toddler toothpaste. Xylitols are great. It's a natural sugar that prevents that bacteria from physically binding onto the tooth. And by doing that, it just lowers the bacteria counts in the mouth. So even Target starts having those, but in your Whole Food, Amazon's a great resource for that, where you can get it cheap and it's sent to your door. So xylitol is another one. But usually under the age of 3, we'll just use a non-fluoridated toothpaste, half a pea size or a smear of that, and going on. For a lot of kids, it makes it fun having some of that paste on there. For some, it can be a deterrent. And so that's why I always tell parents, if the toothpaste or whatever you have on there is becoming a deterrent to brush the teeth, take that out of the equation. At least we're going to get in there with the toothbrush, which is physically getting the plaque off the teeth.
So what do we do about the pacifier now?
That's a great question. You'll go to Babies R Us and you'll see orthodontic, friendly pacifier, and there's no such thing as an orthodontic friendly pacifier. And what I tell parents is, even the APD, American Academy of Pediatric Dentists, they recommend usually within that first 18 months or 15. I usually encourage my patients between 12 and 15 months to get rid of the habit. And getting rid of that pacifier habit before 15 months, it can seem daunting, but it's a lot easier to get rid of a habit before 15 months than trying to extend it after. The best way to do it is to do it cold turkey. I have a lot of parents that will try to do it, I'm just doing it at nap times or just doing it at nighttime. But it can still maintain. And what a pacifier thumb-sucking finger habit can do is it really can cause a lot of orthopedic change in the way that upper and lower arch forms. One of the easy way for us parents to notice is bucking of those front teeth out and kind of pushing back of those bottom teeth. The second thing it does, instead of that upper arch forming that nice U shape, it starts to kind of collapse that palate and really vaults the palate and starts to form more of a V shape. And what that does is, instead of those top teeth fitting over the bottom teeth lock and key, it starts to form a crossbite. And for them, that's something that can only be fixed orthodontically. So by getting rid of it before that 15-month period, or that 12 to 15, you can ensure that isn't going to happen. And so the other thing that pacifier and thumb or finger sucking can do is, by bucking those front teeth out, those front teeth don't have that natural support. And so in trauma prevention, that 0 to 3 age group is the most common age group to get some sort of facial or dental trauma. And there's no deciphering between boys and girls during that age as far as their incidence for getting that. And having those teeth out further, they're more prone to fracture, knocking out completely, or avulsing. So try and get rid of it. That will come back. And even if you've had some movement, that will usually come back if we can get rid of the pacifier habit. I
had a child come to my practice who had the pacifier way too long, and they closed their mouth, and you can literally put your finger through the gaping hole from there. And I try to tell parents at 1 year of age try to remind them that their child is not going to go to the store and buy another one. So just simply get rid of it. It will be okay. What do you do to help prevent cavities, though, in the little ones?
So one of the big things with cavities is, there's 3 different reasons why we'll get cavities. One's are brushing and flossing type of habits. One's are eating and drinking. And the third is that bacteria that we inherit. And that's the biggest thing I can give for those new parents that have never had kids, is that bacteria. That's the direct correlation we have between mom and dad's oral health and our child's. One of the questions I hear all the time, I had a ton of cavities, I must have had soft enamel as a kid, I'm sure my child is going to have the same thing. Well, it's pretty rare that you're going to have that soft or hypoplastic enamel. And what it is, the correlation is, if mom and dad's had a lot of cavities, they have usually higher counts of that bacteria that causes cavities, that strep mutans. And the mouth can't be colonized with that until the first tooth pokes through. So we have some time to prevent that. But as soon as the first tooth pokes through, we eat something, we share it with our child, we lick the pacifier, or we're eating something and share it, and all of a sudden the mouth gets colonized. And so that's that correlation. I have kids all the time that don't have the greatest eating and drinking habits, and not the best brushing and flossing habits, and not have the cavities, and others that are attempting the right diets, attempting the right things. And sometimes the biggest part of that triangle of getting decay is that bacteria. So one of the best things is when you're starting to expecting is to really make sure that we're doing a great job with our own oral health care, and that can be our primary caregiver. Mom is usually that, but if dad's staying at home or a nanny, making sure that they also as well. As far as diet goes, we want to try to avoid those sticky fruit leathers. Gummy candies and snacks are really popular on the market, and you go to Costco and they have organic, safe. But what's tough about those sticky kind of snacks is that they stick to the grooves of those teeth, and they're tenacious to get out, and it takes a lot of effort to get out, and so you have that constant source for that bacteria to multiply. The other correlation with kids trying to prevent cavities is oftentimes we'll see an increase of cavities with kids that we call grazers, kids that are snacking out throughout the day with those cookies and snacks. And I know you speak a lot.
It doesn't help much with their weight, and it doesn't help much with their teeth. We don't have much time left. Do you think you can comment quickly on why children tend to get those white lines on their teeth and what we can do about it?
Yeah, one of the common things that we see at that age is those white lines are oftentimes caused by the first starts of cavities, which is we have plaque and that diet that's contributing to demineralization of the enamel. And what happens is it kind of starts to show up as a white chalky line, white chalky areas. Those white chalky areas then start to translate into brown spots, and then little holes and cavities starting to form in there. In some cases where there's areas of well water or things like that where we have maybe more fluoride in the water, sometimes you'll get those white little streaking. But the biggest difference is you can see that they're very hard. They're usually lined in nature versus more generalized on the tooth or associated around the gum line. And so that's one of the things that common that we see in the staining realm. The other one is usually trauma. Kids are falling all the time, and it may not be a thing where I have a big puffy lip or a swollen lip, but it was enough to cause some trauma. You see those kids with the grayish nature to the tooth.
Right.
And it's just that underneath that white layer of the tooth, you have little tubes that connect to the blood and nerve supply that you'll get some blood products trapped and seeing that dark discoloration. Other times you'll see that the tooth actually do a root canal on itself and calcify, and that will show up as that yellowish brown.
Yeah. Well, there are certainly a lot of issues in pediatric dentistry that cannot be covered in a mere 15 minutes.
Yes.
But I really appreciate you coming out there. It really brings home that one really should be going to the dentist from an early age, 1 year of age, to start getting the feel for the dentist, to know what's going on, and to make sure that we end up with a nice full set of teeth that are nice and healthy. Sunny, thank you very much.
It was a pleasure being here. Thank you so much.
I am Dr. Carey. I appreciate you being here. For more pediatric information, please come to our website at drcareys.com, where you can also join our newsletter. And again, at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay, let me see your ear.